Baptist Hospital. Myself, Dr. Anupama. This is Dr. Saru, the head of oncology and hematology. He is Dr. Vinu Saradi, our medical oncologist. So today we will have a brief discussion about cancer, the various treatment modalities, and hopefully it will dispel few myths about cancer, its treatment, and other factors associated with it. Okay, so we'll start off. Ma'am, just wanted to know, because today is the World Cancer Day, we just want to know what is World Cancer Day and the significance of World Cancer Day.
So 4th of February worldwide has been marked as the World Cancer Day, and this is to raise awareness about cancer, the prevention, detection and its treatment. Now this is being led by UICC, that is the Union for International Control Cancer, and it is basically to reduce the illness and death due to cancer. Now this World Cancer Day was first established on 4th of Feb 2000 at the World Cancer Summit against Cancer, and every 3 years there is a theme which is associated with the World Cancer Day. So from 2019 to 2021, the campaign theme was I am and I will, and the present theme, that is from 2022 to 2024, the campaign theme is Close the Cancer Gap, and this is basically to identify and address the barriers that people around the world face in getting access to cancer care.
Okay. So Dr. Vinu, just for the understanding of the general people, can you add a few lines on what is cancer, what causes it, and what are the common symptoms, and generally when should a person seek medical advice is suspecting cancer?
So basically cancer is a disordered and an unregulated proliferation of a normal cell. So for the first myth is that cancer is communicable, it can spread from body to body. It does not behave like a bacteria or virus. It originates from within the person's body. It can originate due to many reasons. One of them is hereditary, one of them is mutations acquired due to any chemicals, toxins, pollution, tobacco and many of it. And some cancers are due to viruses or some bacteria, some such type of organisms. So in general cancer is not communicable, so the caretakers and the people staying with the cancer patient need not be worried that they are going to acquire or get cancer by taking care of them. Second, what are the common symptoms of cancer? Common symptoms of cancer are a wide array. Usually we tell people to be aware of things like a non-healing ulcer, a sudden rapidly increasing lump, symptoms which persist for a long time like indigestion for a long time, involuntary weight loss, persistent diarrhea, bleeding from any rectum or any orifice, a sudden increase in the change of a wart or a mole. Such things should immediately alert you, and anything which is persisting like a nagging cough or anything, please visit your nearest doctor immediately to rule out cancer.
So ma'am, how do we confirm cancer and what are the usual common tests performed to diagnose it?
See, one of the things we should understand is there are many diseases that may mimic cancer, such as tuberculosis or even benign tumors. So it's mandatory that we establish a diagnosis of cancer before we start its treatment. So some of the tests that can be done to help us in aiding the diagnosis for cancer are radiological tests such as CT scan, MRI, ultrasound, mammogram. And these radiological tests are dependent on where the site of the tumor is. For example, if it's a brain tumor, an MRI will be helpful to aid in the diagnosis. If it is an abdominal tumor, a CT scan or an ultrasound will help us in aiding where the tumor is. And a PET CT scan is also one of the latest modality that has been used in the last decade or so. And this is mainly, it helps us in finding out where the primary tumor is and also where the spread of the tumor is. Has it gone to other areas? It helps us in the diagnosis. Now, certain blood tests like blood markers like serum PSA or prostate specific antigen, CEA, CA125 will also aid us in a possible primary, where the possible primary of a cancer is.
So,
But the mandatory test is a biopsy.
yes.
Like I said, radiology will give us a clue, but it is not confirmatory unless we do a
So
biopsy.
confirmatory test is
Yeah,
a
and biopsy basically is taking a small piece of tissue from either from the primary tumor or from the area that it has metastasized, and this small piece of tissue is looked under the microscope, and the pathologist will confirm whether it is definitely cancer or not cancer. So biopsy is a mandatory test.
So basically we will do a biopsy to confirm the diagnosis, and we will do the various tests in terms of scans and all to what is called as the staging of the cancer.
Yes.
So now can you just add a few lines on different stages of cancer and what are the various modalities of treatment available in the treatment?
So the first question is regarding the staging of cancer. Now, staging basically it gives us the extent of the disease. Is it the cancer is confined to only that organ? Has it involved the surrounding organs or surrounding structures? Has it gone to the lymphatics, which are regional? Has it gone to other distant areas of metastasis? Basically the staging will give us an extent of the disease, which will help us to prognosticate as to what are the chance of survival in this particular patient depending on the stage, and it also helps the doctor to decide what will be the modalities of treatment that can be offered to the patient at a particular stage, because treating a patient in an early stage, the modalities which are used in the early stage will be different from the modalities of treatment that are used at a later stage. Now, staging of cancer briefly is from stage 0 to stage 4. Stage 0 is a pre-invasive stage or a pre-malignant stage. That is when the cancer is not yet invasive. Stage 1 is when it is usually organ confined. Now, I can take an example of breast cancer. In a stage 1, the cancer is only confined to the breast. In stage 2, it has gone to the axillary lymphatics, that is the regional lymphatics. Stage 3 is when it has involved the supraclavicular lymph nodes, and stage 4 is when it has gone to a distant area like the lung or the liver or the brain or the bone. So understanding or finding out the stage of the cancer will help us decide, are we looking at a cure in this particular patient or are we looking at only palliation? And the ways, as I mentioned earlier, to know the staging of the disease is basically by a clinical examination and also by the use of radiological modalities such as PET CT scan or CT scan or an MRI. So that is important regarding the staging. Now, presently, it is not just the anatomical staging, but certain tumors, even marker tests like ER/PR, or HER2/neu are being incorporated into the staging protocol for cancer right now. So presently, apart from the anatomical staging that is incorporated into the staging protocol, we also add biological markers such as ER/PR, that is estrogen receptor, progesterone receptors, HER2/neu receptors, have been incorporated into the staging for cancer. Now, the second question that you asked regarding what are the treatment modalities for cancer. The three modalities which are used is, one is surgery, where the onco-surgeon, that is the surgeon that is specialized in cancer treatment, cancer surgeries, remove the gross tumor and the draining lymphatics. Now, there are different types of cancer surgeries. There are surgeries which are done with an intent for cure, where the tumor and the entire organ can be removed, or there is also where only the tumor is removed and the organ is preserved, as in breast cancer treatment, what we call as breast cancer conservation surgeries. The surgeries are also being done for palliation, that is to just relieve the symptoms. such as if there is a tumor that is compressing the spinal cord, then to relieve the compression, surgeries can be just done to as an intent of palliation, they can be done for that. Or if there is a intestinal obstruction, then a diversion surgery can be done where a part of the intestine can be brought to the abdominal wall, and this is basically done with an intent to relieve obstruction. So the next modality of treatment is radiation therapy, and radiation therapy is basically the use of high energy X-rays for the treatment of cancer. And here high energy X-rays are focused onto the tumor and the regional lymphatics, and or it can be given after the surgery is done, where the radiation is focused to the tumor bed. So it can be done either before surgery or after surgery, that is either as a neoadjuvant or as an adjuvant treatment. And here the radiation beams are delivered by a machine called a linear accelerator. That is when radiation is given as an external treatment or an external beam therapy. Now, radiation therapy can also be given in a palliative setup, that is with an intent to just palliate the symptoms, especially in a patient who has in a stage 4 disease, where we know that we are not able to achieve cure, but we are trying to relieve the symptoms. So for example, if there's a patient who has a breast tumor where the cancer has metastasized to the bone, then to relieve the pain in the bone, radiation can be given for about 10 days. Radiation can be given, or a short duration radiation can be given to that specific area. It is again, like I said, to only to relieve the symptom and not with an intent for cure. Now, radiation therapy can also be given as an internal radiation, what we call as brachytherapy, and here this is the use of radioactive material which is placed into the tumor directly or around the tumor or close to the tumor. So these are the two types of radiation therapy, that is external and internal radiation therapy. Now, the third modality is the use of chemotherapeutic agents and other agents like immunotherapy and targeted therapy, which I think Dr. Vinu will be discussing about.
Yeah. So, Dr. Vinu, we just want to know, like, how is chemotherapy given? Because most of the people have this idea that chemo is a very bad thing. They have a lot of complications. Whoever takes chemo falls very sick. No one will be able to tolerate it, and often that becomes a reason why people do not stop their treatments. So, how is usually it is given? What are the common issues we can expect with it? And apart from that, what are these targeted therapies and immunotherapies recently which people are talking of?
Yeah, chemotherapy are basically chemical agents. They are available as an IV injection or as tablets, and they preferentially work to destroy the cancer cells and have lesser toxic effects on the normal body cells. So chemotherapy, the first myth is it is not painful. It goes as a simple IV infusion, just like you take a dextrose infusion or a saline infusion. So it is not painful. And the main side effects of chemotherapy are basically hair loss, some amount of loss of taste sensation, some abdominal discomfort, maybe diarrhea and nausea, for which we have very good supportive medication and which is easily manageable. The chemotherapy 90% does not lead to any permanent side effects or anything, and it is manageable 95% of the time. So these are the myths that the chemotherapy is painful, it has long lasting or permanent side effect, it will scar the patient for life. All that it is not true, and these days we have more refined molecules, we have more better delivery systems with which chemotherapy is very tolerable, and it can be given with age no bar. Even an elderly person who's fit can receive chemotherapy and reap the benefits with very little side effects. Now coming to, we are in an era where we are not just hitting the tumor with non-specific chemo, but we have completely typed the tumor based on genomics and molecular profiling and understanding the pathways with which the cancer is growing. And finally, we are first finding the target and then designing the drug against the target. So we are entering an era of targeted or a personalized therapy to cancer, and which is called the fourth pillar, or targeted and immunotherapy. So these days with targeted therapy and immunotherapy is basically boosting the body's own immune system to fight against cancer. So these are all very selective therapies where they preferentially act only on the cancer cell with very less side effects or sparing the normal cells, and where they have shown very good benefits, and this is the direction in which we are heading.
Okay, so having said that there is genomic profiling and all, just to know whether cancer runs in families, if it does, do we have any tests to see the particular person's risk or the other family members' risk of developing cancer in a family where one person had any malignancy?
Yeah, so cancer previously we did not know much about cancer and its hereditary effects and how much percent is familial, because we did not have good access to genomic testing. But these days, with easier access to genomic testing, we are finding out that up to 5 to 10% of cancers can be familial. And the most common familial cancers are breast cancers, ovarian cancers, and these days they are finding even prostate and pancreatic cancer may have a genetic basis. So for this, whom we encourage for testing is if somebody who's got cancer at a very young age, like we do not expect any colon cancer or lung cancer, breast cancer at a very young age. So usually in them we encourage for genetic testing. Somebody who has a very strong family history, like we say two or more first degree relatives of the patient who has had cancer, then we encourage for genetic testing. Or if there have been more than 3 cases of cancer in the family, we encourage for genetic testing. So these are the cases where we definitely recommend genetic testing. So we do have currently tests. We have a simple blood test which encompasses more than 100 genes, which commonly screens for all the germline or the genetic inherited cancers, which is easily available in many centers these days with a turnaround time of around 3 to 4 weeks, which can clarify doubts of many people whom a suspected inherited cancer condition may be present.
So, ma'am, just can you add a note on what are the common cancers we see across in a daily practice, and are there any screening tests for cancer which we can use, and for if yes, what are all the cancers where we can suggest screening?
Now, the common cancers in our Indian setup is among women, it is mainly breast cancer, which is the most common cancer among women now, presently, both in urban and in the rural setting. And cancer of the cervix and head and neck cancers, that is mainly because of the use of or chewing tobacco. So oral cancers and oropharyngeal cancers are common in our Indian scenario. Among men, the most common cancers are head and neck cancers, again because of the habit of chewing tobacco and alcohol, and we also see an increasing number of men with lung cancers and colorectal cancers among men. Now in children, the common cancers that we see are blood cancers, that is leukemias, and brain tumors. Now the second question you asked is very important. What is screening? And it is a very it's important for the common man to know about screening, because screening basically involves looking for cancer in a group of healthy individuals who do not have any symptoms. Now, if a person comes with symptoms like a lump in the breast or bleeding from the rectal area or from other areas, and or an ulcer which is there in the mouth or the skin, then it is no longer a screening. It is, you go directly for diagnosis. But screening is in a group of healthy individuals with no complaints. You are looking, is there cancer or not? And the importance of screening is finding cancer at an early stage improves the chance of cure, and the treatment modalities that are required in early cancer are very minimal to achieve cure. So can all cancers, do all cancers have screening tests, and have they found to be beneficial? Not in all cancers, but in a few cancers it is very important, and I would really urge the common person, that is dear friends, I would urge each of you all to avail of the various tests that are used for these 3 main cancers. The first being breast cancer. Now the screening that is used in breast cancer involves a self breast examination by every woman above the age of 25. what we call as breast awareness. So above the age of 25, every woman should be aware of how they should examine their breast, and if there is any changes that are different from what is normal, they should consult a doctor regarding that. The other thing is above the age of 40, a person with average risk, that is those who don't have a family history of breast cancer, then above the age of 40, every woman should have an annual mammogram and an ultrasound, and they should go to a doctor or a trained nurse every year for a clinical examination. Now, when we talk about mammogram is actually a simple outpatient procedure. It is an X-ray imaging of the breast, which is done in different views, that is from top to bottom and from side to side. And the benefit of mammogram is it's a very sensitive test. It picks up tumors that are very small, even less than a centimeter, which may be missed during a clinical examination by the patient or by the doctor. So women above the age of 40 should go for an annual mammogram and an ultrasound. If, as Dr. Vinu said, those patients who have a high risk to develop breast cancer, those with a family history of breast cancer, then in that group of patients, the screening for breast cancer should start earlier than 40 years or 10 years earlier than when their relative have been diagnosed to have breast cancer. Now, the other tumor where screening has been found to be helpful is a colorectal cancer, where colonoscopies can be done to diagnose a cancer in the colorectal area much earlier than when it actually even forms into a cancer. So the current recommendation is that all individuals should have a screening by a colonoscopy after the age of 50, and that can be done once in 10 years. And the benefit is again very early polyps or very early tumors can be picked up by a colonoscopy. If there is a patient with a family history of colon cancer, then the screening by colonoscopy can be started much earlier. Okay. The third cancer where screening has been found much beneficial is the cervical cancer. Cervix is the lower part of the uterus, and a simple test, what's called as a pap smear, can be done in a OPD setting. A patient need not be under anesthesia, there is no sedation, and it can be done by a gynecologist or by a family practitioner doctor. And it's a simple test, and again this pap smear will help us to find out cancer at a very early stage. So these three cancers, that is the breast cancer, colorectal cancer and pap smear, there is very easy simple test that can be done to find cancer at an early stage, and these screening test has found to reduce the death caused by these cancers. So that is something that as a common person or as a public, you need to realize that these screening tests are easily available in most hospitals. So I urge you to please get yourself screened. And which type of screening test to be done? Should we do ultrasound, mammogram, colonoscopy? All these can be decided in consultation with your doctor. Now, in the last decade or so, lung cancers, also there is a screening, what we call as a low dose spiral CT scan, but these are done only for patients who have a high risk of developing lung cancer, that is patients who have been smokers for 15 years or more. Now, the other cancers such as the ovarian cancer, prostate cancer, thyroid cancers, testicular cancers, tests are available, but even those screening tests have not helped to reduce the death caused by these cancers.
Dr. Vinu, would you like to add any other points to this particular discussion?
Like ma'am has said, I think screening is the way going forward, because we know earlier detection translates into a better cure. So these days, even though research has contributed towards improved survival in the advanced stage, we are looking to uncover cancer in the earlier stage, maybe stage 1, 2 or even stage 0, and take the necessary preventive measures. So screening is the way to go, and I think universal screening, and as it reaches out to more population, as we say, close the gap. So I think you have to close the gap and make it available for most people, and that the first step towards that is awareness. As more people get aware, they will come in for more screening, and that will be the way to go forward.
And also remember, screening does not prevent cancer. It only helps to pick up cancer
an
at an
early
early stage. So it's important that at the right interval, the screening test have to continue. It is not that it's just done once and then forgotten. So it has to be done on the required time interval.
To sum up just to be aware of the warning signs or abnormal signs, please seek the help of a doctor as and when you require. Be aware of the screening modalities. Also know your risk of cancer if you have any family history, because the earlier you detect, the better will be the outcome of the treatments. So we at Bangalore Baptist Hospital have the standard treatment at an affordable cost. We have a very good team of oncosurgeons, radiation oncologists, medical oncologists, the hematologists, and also the transplant specialists who handle the bone marrow transplants, and also a good palliative care team, which so that we can provide a comprehensive cancer care. That's all for now. So signing off, myself, Dr. Anupama, Dr. Vinu Sarthi, and Dr. Saru.
Thank you.
Thank you.